I did this project along with Tim Tyner from UCSF, and Tim and I were interested in understanding whether the day-to-day variations in ozone and particulate matter had health effects. And we were thinking that some of the pain that people report about asthma and other respiratory conditions in the valley is really about the day-to-day variation in the quality of the air. We focused on the three largest urban areas in the valley, and we drew a 5-mile radius around the air quality monitors in those towns. So for those three areas that we were interested in, we looked over several years at during the summer months or the fall months, the day-to-day variation in ozone or particulate matter. And then we had data on emergency room and hospital visits. We looked at who went to the emergency room, who went to the hospital the day the air was bad, and for several days after. And we were able then to relate the day of the healthcare admission to the day that the air was at a certain level. On the days with the worst air, more people were going into the hospital, into the emergency room, particularly for asthma. But at the regional level, we also found the effects for other health conditions, for example, heart attacks. There's a growing sense in the United States across many communities that racial, ethnic, and social class disparities, differences in health outcomes, are really inequities. We wanted to see whether there was evidence for that idea in our region. And so we had data that examined life expectancy or premature mortality for every zip code in the central San Joaquin Valley. And so we're able to track kind of long-term, stable patterns of how place might be related to health. And we found dramatic effects. Affluent neighborhoods in Fresno, affluent neighborhoods in the other cities of the valley, experienced rates of premature mortality that were as low as those in Japan, better than the US average, people living into their late 80s and early 90s as a regular matter. We also found in communities less than 10 miles away often, where we see mortality rates that are 20 years different, where you see a 20-year difference in life expectancy, double the rate of premature mortality between these communities. We're talking mostly differences between states or differences between communities in the US of 2 or 3 years. 6 months is a big difference in many places. So this is a really big finding. We also found that it was pretty predictable. You can see in these communities with the worst outcomes, it hits you in the face. It's not a big surprise. You see empty houses, you see burned out lots, you see the lack of schools, the lack of stores, the lack of parks, inadequate infrastructure to walk around, streets, sidewalks, cuts. And we know as we start to track these communities, they're the places with bad water, they're the places with inadequate education systems, they're the places that are too far from health centers or don't have any health centers at all. So you have an accumulation of very easily identifiable differences in the basic quality of life. It seems to me if we could focus on equity as a broader concern, I think that's how we make progress. And to say systematically, how do we make this a place where people can continue to live and can really come to live well?